In one of the most recognized studies in healthcare, the Lancet study on global burden of diseases, India ranks 145th among 195 countries. Surprisingly enough, our neighbors like Bangladesh and Bhutan are ranked higher than us. With only one doctor available for every 12,000 patients in public healthcare and one nurse for every 600 patients, India is battling an acute shortage of 6 lakh doctors and 2 million nurses. It's not just the shortage of healthcare resources, but whatever little resources we have are concentrated in the top 8 cities and in certain urban pockets primarily. This results majority of India outside these top cities remaining underserved in terms of healthcare services availability. Most of the private investments in healthcare is in secondary and tertiary healthcare in these top cities, and that holds true for most of the digital intervention. Primary healthcare, the first point of contact for most people, has remained a problem for the government to solve, with major gaps in terms of doctors available in these centers. The option for people in underserved areas is to either go to the inadequately staffed primary healthcare centers or a QAC, which is a thriving ecosystem in the hinterlands because of lack of facilities. In some cases, patients go to standalone pharmacies in their locations, who advise them to have antibiotics without any diagnosis. The experience is completely broken if they don't want to avail any of these locally available options and travel to the nearest district headquarters or state capital, which have decent medical facilities available. Here, the cost of travel and stay, usually for 2 members of the family, along with loss of income, significantly increases the healthcare burden. A point to note: in India, about 70% of our healthcare expenditure is out of pocket, pushing almost 50 million people to poverty. Presenting Curebay for a healthier India. Set with a vision of transforming patient experience in underserved markets by delivering affordable and high-quality healthcare through a digital platform, Curebay promises a closed-loop fulfillment. The Curebay model is a hybrid model based on 3 pillars. The first pillar is deep tech. Curebay is a robust platform that brings all services under one roof, making it a virtual multi-speciality hospital. We are on course to build an ecosystem based on network effect through referrals and incentivized influencers. The second pillar is the aggregation of both physical ecosystem such as doctors, hospitals, pharmacies and labs at one hand, and digital healthcare ecosystem players in oncology, cardiac, pulmonary and many other specialties that use data, which is captured through smart and connected devices on the other. It also includes artificial intelligence models to create risk profiles of patients in remote locations that can act as early warning system and help save lives. Finally, the third pillar is a network of satellite centers that are managed by trained healthcare workers that access our digital platform, a telemedicine facility and medical-grade smart devices to connect patients with service providers to help solve most of their primary healthcare needs. In summary, at Curebay, through a hybrid model of digital platform and satellite centers, we are building a healthcare fulfillment model where part of the services is delivered digitally and part physically to solve for the gap in primary healthcare in remote locations. Unrelenting care for the near and far. As an organic extension, patients in the proximity or vicinity to the DHQ and the state capital are benefiting from our network, enjoying the quality and richness of super specialty hospitals. And for those staying abroad, our network packages provide complete peace of mind to the sponsors, as it enables hassle-free home care services along with emergency services for their family members staying in Odisha, India. Curebay, curating an ecosystem of sustainable healthcare. We are tying up with key stakeholders in the medical ecosystem to curate a robust network of effective healthcare pan-India. Join us in our mission. Hello, Doctor. Our deep tech framework not only connects the dots, but it also opens a bridge for you to reach out the erstwhile remotes of India. Access to new patients from Curebay's satellite centers through demand generation activities in hubs and spokes. On-ground activities, road shows, wall paintings, nukkad nataks, mass media campaigns, both traditional, digital and social. Once you register with us, gain access to free usage of platform for existing patients. Curebay will not charge commissions from patients onboarded by the doctor. Curebay will give a share of revenues and benefits for other services for patients onboarded to the platform through digital tracking of transactions, ease of sharing and accessing prescriptions digitally, access to and intuitive search of patient and patient records, easy referrals to hospitals and specialists. Doctors on Curebay platform will be covered under an insurance and/or indemnity scheme, efficiencies in appointment, scheduling and time management without any platform cost for own patients. Conclusion: with Curebay e-clinics, now you can save time, money and effort and get high-quality healthcare services in a location near you. Visit www.curebay.com to find out more.